how many cases you performed in your experience?
More than 200 cases.
That if anybody drink from the Nile, he always come back.
I have to do.
You have to do that.
New technologies are emerging, and Equalizer, in my opinion, is one of these.
We are the only center who are using the Equalizer in the whole Middle East. احنا عملنا اكتر من 100 حالة في سنة. هو عمل 200 حالة في 5 سنين. بودكاست مش للرجال فقط. بودكاست هنرجع برضو ونرجع نقول نفس الكلام. ازيكم يا جماعة، عاملين ايه السادة المشاهدين والمستمعين؟ Today we have one of an expert in urology, Dr. Franchesco Sisa. I'm telling the name in the right way because when I read it before I called you, I was reading it Francisco Sisa.
The Italian pronunciation is Francesco Sessa, but it's okay.
It's okay.
It's okay.
Because you are a nice guy, but it's okay. But it's not your name, Francesco. Your name is Francesco Sisa.
Sessa.
Yeah, Sessa. It's not Sisa.
Similar.
No. Tell me your name.
Sessa.
Sessa. My name is Abu Talib because all the time you say Professor Talib in the conference.
Yeah.
Talib is half my name.
No.
My family name is Abu Talib. Abu means the father of Talib. So I am Abu Talib. This is my family name. My name is Ahmad, like Francesco.
Okay.
Tell me a very important thing. What did you see in Cairo?
Nothing.
Nothing. Yes, you told me that. You didn't see anything.
I've seen a wonderful hotel that is one where we have the conference and a wonderful view on the Nile.
So you saw the Nile.
Yeah.
So you saw a part of Cairo.
Yes.
This is the only part you saw in Cairo, which is the River Nile. You know, there is a part always we say that if anybody drink from the Nile, he always come back. So
I have to do.
You have to do that. You will do that. You don't have to do anything. You will come.
I come.
This is a fact. And I think you know that you are coming again.
Yes.
Yes?
Sure.
And next time you told me that you are not just will come for just working for 2 or 3 days. They're like we did in this 2 hectic days. You have to take a vacation in Cairo to see Cairo.
Yes.
Yes?
Yes. My plan will be to combine, to balance work and for sure vacation.
Yeah. By the way, Francesco Sisa is one of the important urologists. He is very young. How old are you, Sisa?
35 years.
He's very young guy, but he has a very good experience in a technique for the treatment of BPH. BPH is the enlargement of prostate. ايوه محمود، يعني في تضخم البروستاتا، يعني عشان بس نفهم اللي هي البي بي اتش ده اختصار للبناين بروستاتيك هايبربليزيا اللي هو تضخم بروستاتا. ايوه محمود، هو اللي بيتكلم عن الإيكوليزر اللي احنا قاعدين بنشتغل فيه. هو عنده خبرة كبيرة جدا في الإيكوليزر. How many cases you performed in your experience?
In the last 5 years.
You started 5 years ago.
Yes.
Long time.
Long time. More than 200 cases. But I saw that you have experience here. I saw in the OR, and I know that you have treated a lot of patients with this technique.
Yes, yes. ما تنساش يا محمود، خلي بالك احنا عملنا اكتر من 100 حالة في سنة. هو عمل 200 حالة في 5 سنين. هو مستغرب من الموضوع ده، فما تستقلش بيها يا محمود بقى كل شويه وتفضل تقول يا عم الخواجه جه ومش الخواجه ده عنده اكسبيرينس جامده جدا، بس احنا مش قليلين، احنا جامدين قوي برضه. في سنه واحده عملنا نص اللي عمله. I'm just translating some points because my friend Mahmoud is always telling me that you are a little bit weak. No, we are very strong and we have a very good muscles. Yes?
Yes.
And you saw that in the OR.
Yeah.
What's your experience about the conference when you came here in Egypt, and what was your expectation about this conference, especially that you performed before a workshop with some colleagues here in Egypt. Yes.
Yes. But this was first time for me in Egypt and first time in a conference like that. So when I was in my flight, I was thinking about what were my expectation, and I had no answer about that. But I have to say that I'm really impressed.
You have to admit, no, you are not going to say. You are admitting, yes. Huh?
Yes.
You are admitting that
I'm-
these.
I'm really impressed about all the organization, about logistic and on a logistic, scientific, and point of view. So the conference was very, very amazing. Because of the contents, because of the speakers, because of the new emerging technologies. And I don't know how to say differently, but I'm really impressed. This is my sensation about that.
This is a certificate for us from an expert from Italy to tell us that you are impressed from our work and our conference. Really, this year was impressing for me because this year, as I told you a few minutes ago, that we had more than 600 attendees. This is a very big number for a urology conference in Egypt. And we had about 75 speakers and more than 100 chairmen. We performed 5 live transmission, 3 from Cairo, from Nile Badrawi Hospital, 2 from India. And then the most impressive thing that we performing 7 workshop. And the amazing thing that when I went down in the conference and was attending one of the workshop, the people, they don't want to go. They don't want to finish this session. They were very excited in the workshop, and a lot of conversation and sharing the experience between each other.
I know I've noticed the thing also tonight, because at 8 p.m. we were also discussing about
Yeah,
what
and everybody
happened.
was hungry,
Yeah,
want to
yes.
eat.
Me too.
Yeah,
I
and
was-
they're still discussing the scientific work.
yes.
go home, go for eating. هي الناس النهارده اصلهم كانوا جننونا قوي يا محمود. يعني الناس كانت عايزه جعانه لغايه الساعه 8 بالليل ومصممين ان هم يكملوا النقاش بتاع الورك شوب اللي كان موجود او ورشه العمل اللي كانت موجوده. What do you think about equalizer? What's your tell me, do you like this technique, and do you push the patient and tell them that you have to do an equalizer, and which patient you don't like to do an equalizer for him?
You know, I have to say that when I started performing this procedure five years ago, I was really excited about this technology, because I'm really convinced that the urological panorama scenario is changing over time, and new technologies are emerging, and equalizer, in my opinion, is one of these. It is a promising technology that allows to be allow the patient to be to improve the symptoms for a large prostate in a very good way. I mean, in an outpatient setting, without no risk for fundamental aspects in our society, that are continence and ejaculation function, and with no need to undergo under surgical operation. So, I mean, all these are all aspects that in our society, especially for young men, become very, very important.
شفتوا زي ما احنا بنقول، يعني هو نفس الحاجات المهمة اتكلم عليها زي ما احنا بنتكلم بالظبط، انها اهم حاجة انها بتحافظ على القصف وانها بتحافظ على التحكم في البول، ودول اكتر حاجتين بيهموا المريض. والحاجة المهمة الثالثة ان العيان بيحافظ على البروستاتا. يعني هو البروستاتا ما زالت موجودة، والفانكشن او الوظيفة بتاعتها ما زالت موجودة، وبيبقى مطمئن ان هو مش هيحصل له قصف داخلي، وهيبقى مطمئن على التحكم في البول. I'm just emphasizing and highlighting about two important things which always I can see it in the eye of the patient. The patient come to us to do an equalizer for two important reasons. The first two important reason that he is going to preserve the ejaculation and the sexual function. The second thing, he is 100% sure that nothing will happen in the continence of the urine. And all this can be under the title that the prostate is still there. I'm not going to remove the prostate. My prostate is still there. I'm going to decrease its size, and I still have the same function for ejaculation and the continence. I agree with you totally, because I think this is the important two messages that the patient is very attracted for this technique. Do you have the same things in
Yes.
Europe and Italy?
Yes, I have the same sensation when I speak with my patients, and I have no doubt about that, because when I speak with them, I explain the technique, I explain pro and cons about that, but there are some things that are certain about. We stay very far from the urethra, very far from the sphincter, and very far from the capsule. It means otherwise, from ejaculation sparing technique, a possibility to preserve continence and sexual function, and then improvement, of course, of symptoms that are the main reason. That is the main reason why patient come to my attention.
Okay. How many patients from the 200 patients you performed came complaining that he lost his ejaculation?
In my personal experience, no one.
No one.
No.
صدقتني بتحافظ على القصف. 200 حالة ما حصلش فيهم قصف داخلي، يعني 100%. وده رقم كبير قوي، مع ان ما فيش حاجة في الطب ابدا اسمها 100% success rate او نسبة نجاح ان هو يحافظ على القصف. And what about the continence? Do you have any patient complaining from the incontinence after this technique?
No one.
برضه مصمم، مفيش حد بيحصل له اي مشكله في عدم التحكم في البول. نفس الكلام اللي احنا بنقوله، ونفس النتائج اللي احنا بتحصل معانا، عندهم نفس النتائج. Tell me, your patients are Italian?
No, someone comes from other country, but in Italy it is not so common to move for a surgical operation. But we are very large, in a very large center with a very high experience about this technique. So in our cohort of patients, we have some patient that comes from other country to be treated.
Okay, some countries, for example, like France or
Principally mainly Europe.
Mainly Europe.
Yeah.
But the percentage is not that big.
Not so big, maybe 5-10%.
5-10%, because it's different in our market, in our country, in our experience. Maybe 50 to 60% from our patients are from the surrounding countries. We have a lot of patients from Libya, we have a lot of patients from Sudan, we have a lot of patients from Saudi Arabia, Kuwait, Yemen, United Arab Emirates, Jordan and Palestine, and Iraq, and the other 40 to 50% are Egyptian. You know why?
Why?
Because we are the only center who are using the equalizer in the whole Middle East. There is no other centers even started. And I asked the dealer today, and I asked Muaz, who is the responsible about the Middle East, how many doctors are using the equalizer in the Middle East. He told me no one except us until now. So till now, 1 year we are working, and still no Middle East working with this technique.
In other words, you are the only referral center for this.
Yes, we are the only referral center for making the equalizer for all this region. And this is really fantastic for us, that we are unique for other hospitals or centers specialized in urology. زي ما احنا بنقول، انا لسه متاكد من المعلومه دي لغايه دلوقتي. احنا بقى لنا سنه شغالين، مفيش غير يوروبرو في الميدل ايست هو اللي عنده تقنيه الايكوليزر. ومش بس عندنا تقنيه الايكوليزر، لا، we have experience، عندنا خبره 100 مريض، success rate 97%. يعني كل العيانين او اغلب العيانين اتعالجوا كويس جدا ومبسوطين جدا وحافظوا على القصف وحافظوا على التحكم في البول. Uh, what do you think about making a collaboration with your university, Florence University? As I told you, it's very important to us to share with you your experience and our experience to have better results for our patients.
It is a very important point, and I confess one of the reason for which I accept your kind invitation, because I think I'm really convinced that uh, it, to increase this technique, to increase data about this new technology, we have to share information, we have to share data in order to understand what are the potential benefit from this technique and also its potential limit. And the only way to do this is to share data. And of course, for sure, collaboration is a fundamental, is a key step that has to be done.
When we requested to invite you to come to our conference to share with you your experience with our experience, did you think that you are going to the doctors who are riding the camel in Cairo and they don't know anything, and I'll go to see some people starting from scratch, and I'll take a long time and I'll make a lot of work to let them understand this technique? Or what was your impression?
No, I had no doubt about that, because we had previously conversation about that, and you felt very confident with technique, with results, with your experience. So my impression that has been confirmed is that
I don't want any kind of
No.
compliment.
No.
I just want to know how was your feeling.
Yeah, my feeling is this. I was really convinced of this, and today I can say this, that I'm speaking and talking about something you know and you have experience on.
And what was the experience, or was the opinion of the company Elista about our work? And when they told you that the Dr. Abu Talib and Europro want you to come and join with us our conference and to share our experience, what was their message to you about Europro and Dr. Abu Talib?
They presented me this opportunity as something with a lot of potential positive aspects, because they told me there is a center with previous experience that want to know about equalizer from someone who has experience, but that want to increase this technology, because Europro is really convinced on this technology, and this is one of the reasons why I decided to come here, because otherwise I would have not accept or declined the invitation, because I don't know. I want to. I'm really convinced on this technology. I feel it is a good technique, but I would like to share information with and data with someone who is convinced at the same time.
And when you came to the conference and you said your speech, your presentation, by the way, it was very nice presentation.
Thank you.
And I admire it a lot, to the point, and it showed really you have a good experience with this technique. What was your feedback about the doctors, the urologist from this technique? Did you feel that they know this technique and they are discussing really specific important points, or you felt that they still don't know nothing about this technique, and we need to do a lot of effort to let the urologist in Egypt and the Middle East to know more about this technique?
The first sensation I had was curiosity about that. So the impression I had was that some doctors, a lot of doctors, don't know about this technology and the detail of this technology, but they understood the importance and the potentiality of this technology. So curiosity is the sensation can be described what I felt.
Did you feel that the doctors, in some extent, that they are attacking you or attacking the technique, or they are still not admiring this technique, or just only curiosity?
Maybe someone who doesn't know how it works, or on the other hand, someone who has not experience with ultrasound, because it is a key point for this technology, uh, makes some try to find some negative aspects on this. But in my opinion, this is my opinion, uh, doctors who have experience with ultrasound, who wants to increase their knowledge about that, have shown curiosity about that.
I have this problem. The problem here, if I have a patient and he came to me and I told him about the equalizer, and if he has some friend, a urologist, or he knows another urologist and want to make another consultation, the always the answer, what? What's the equalizer? They don't even know the name. And not just that, always they say it's under research. It's not a technique well established, and it's well established and have a good results. And we have a lot of publications, international publications, and most of them, I don't want to say all of them, because all of them, all I saw about all publications, they gave an excellent results. I didn't see just one single research or paper declaring that they have bad results, or even an equivocal results. All of them have extremely good results. Some results, for example, comparing with TURP and the gold standard of prostatectomy, that the equalizer give the same functional results. So to convince these doctors that the equalizer is an excellent technique with an excellent results, it's very, very hard. You know why? Because it's only one person and one center in the Middle East are doing this technique. دي مشكلة دايما احنا بنقابلها. يعني انا عندي مشكلة جامدة جدا، يعني يا ريت يا زملائي الاعزاء واساتذتي الاعزاء يعني نساعد بعض شوية، ونبقى متأكدين فعلا ان الايكوليزر ده نتائجه مبهرة في جميع الابحاث العالمية. يعني مفيش بحث واحد انا شفته او قريته عن الايكوليزر. انا على فكرة دايما بقرا كل الابحاث اللي بتتنشر في العالم، واغلبيه الابحاث most of the researchers come from Italy. اغلبيه الابحاث كلها بتيجي من ايطاليا، لان هم اكتر ناس. I think Italy is the most important country in the equalizer, and a lot of doctors now are working with equalizer. In Europe, I don't think that. Maybe in UK there is a couple of guys or something just working with the equalizer, but in the whole Europe, I didn't see any publications from other country. Yes, or you have any data that the other country they're doing this equalizer?
In Europe, there is some centers. Italy, for sure, is one of the most important users for TPLA equalizer.
ايطاليا هي اكتر بلد واول بلد اللي اخترعت التكنيك ده، وعشان كده احنا لما جينا عايزين نشير الخبرات ويبقى عندنا خبرات اكبر، احنا لجأنا لفرانشيسكو سيسا from Italy اللي هي منشأ الإيكوليزر. انت عارف زي كده البيتزا، منشأ البيتزا comes from Italy. Equalizer comes from
Italy.
the same.
The
Yes.
The same.
but different taste. يعني ده طعم الإيكوليزر الحقيقة مختلف تماما عن طعم البيتزا. يعني الإيكوليزر there is some smoke you can smell in sometimes if you have a big prostate you're going to use a lot of joules. A pizza is really
Sounds
delicious.
good.
Equalizer is not delicious. It's an excellent technique but it's not delicious. You agree with me about that?
Totally agree.
Yeah. By the way, what kind of pizza you like in
Margherita is
is the best.
the best
for you.
The classic, but the best.
You know, for me, I love the anchovies. For me, if I want to
Acciuga.
anchovies, you say it in Italy, anchuga.
No, acciuga we say.
Anchuga.
Acciuga.
You know, in Arabic we say it anchuga. In Arabic we say anchuga. سهيلة انت اتجننتي من الانشوجة. اول ما سمعتي كلمة الانشوجة فرهطتي على طول. يعني معلش يا جماعة اعذروها، سهيلة ما تقدرش تمسك نفسها عن الانشوجة. على فكرة هو في مشكلة في الانشوجة جامدة جدا في مصر، ان ما بقاش في انشوجة. الانشوجة كلها مستوردة، ويعني ما شاء الله انت عندنا في مشكلة في الاستيراد. الانشوجة يا جماعة يعني احلى حاجة في الدنيا، احلى بيتزا في الدنيا بالنسبة لي انا الانشوجة. الغريبه ان في ناس كتير قوي ما بتاكلش الانشوجه، ودايما بيحبوا البيتزا بحاجات غريبه قوي. انا بستغرب الناس بقى اللي بتاكل البيتزا بالتشيكن. انا عامه عدو الفراخ، يعني انا ما بحبش الفراخ خالص. باكلها مش بس انا يعني لما يقول لي بيتزا بالانشوجه بتجنن. بتجنن برضو. بس انا قصدي لما باكل او الاقي حد بيطلب بيتزا بالتشيكن I don't like chicken.
Pizza.
No. Pepperoni maybe an excellent choice.
I totally agree on this.
Pepperoni, yeah? And what about the anchoga? You like the pizza with anchoga or you don't like it a lot?
I prefer without.
Without.
Yeah.
You like the anchoga?
A little bit.
Little bit. That's why. I love anchoga. يا جماعة أنا بموت في الانشوجا. أول ما جت سيرة الانشوجا أنا طلعت عن شعوري، فمعلش اعذروني شوية. Pineapple on pizza?
No.
He told me that. He told me that they hate the pineapple on the pizza. I don't think there is there pineapple on the pizza.
Sometimes someone, but
someone. Okay, لا يا عم سيبك منه بتاع الباينابل. ناقصين pineapple. I love pineapple but not on pizza. Pizza is pizza margherita, pizza anchoga, pizza pepperoni. The Italian one.
The Italian one.
You know, in the Italian one, they always, I see it in the street, they do a huge pizza like that. Is it for one person? Or maybe it's
who is angry. A person who is angry.
Who's angry.
Yeah.
He can eat this.
He can eat.
It's a lovely food, the pizza, really. Yes. But it's not good for the belly.
Right.
Yeah, for the belly. It's anti belly يا جماعه. الكرش طب قصدي مش الكرش، قصدي البيتزا مش مفيده للكرش. طيب let's go about Cairo again. I think you have plans in the future to do something in Cairo. Yes, except work. We will work with each other, but you have to take some vacation to do in Cairo. What do you dream about when you come Cairo again? What do you want to do?
I ask you what you suggest to do here.
A lot. Out of question, you have to see the museums and the pyramids and the Sphinx. This is fantastic. This is a part. The other part, you have to see how the Egyptians live. ازاي المصريين عايشين وبيعملوا ايه وبياكلوا ايه. You didn't eat until now the Egyptian food. We have a lot of Egyptian food. عندنا فول، طعمية، كشري، ملوخية. You have fantastic Egyptian food. You didn't eat anything of it.
No.
You what did you eat today? Filet.
Today filet.
Yeah, filet. This is an international
cuisine.
This is not Italian, not French, not Egyptians. It's in all countries. You didn't eat something different related to Egypt. But we have a lot of delicious food. But we have a problem with this delicious food. you will get some aches because your stomach is not acquainted about this food.
Not prepared.
Yes, not prepared. So we have to take it slightly, piece by piece. اوكي، لان هو فجأة طبعا لو كلت طعمية فول وبصل اخضر وجرجير والكلام ده مع العيش البلدي طبعا مش هيعدي عليه اليوم. فيعني لازم مثلا يوم ناكله حتة طعمية، يوم ناكله شوية فول صغيرين من غير بصل، يوم تاني ممكن البصل مع حاجة تانية. طبعا احنا في وقت شم النسيم، فكان لو كان حضر معانا الفسيخ والرنجة كانت هتبقى ايام سودة وملهلبة عليه. فالحمد لله يعني ان هو ما جاش، بس احنا هناخده بالتدريج، يعني هناخده بالتدريج واحدة واحدة في زياراته الجاية، ان احنا ناكله الاكل المصري عشان يتعرف على الاكل المصري. One of the most important thing when you go to any country to eat the food of the country. Like yesterday when I told you we have two nice restaurants here in the hotel. One is Italian and the other is Thai. I was 100% sure that you are not going to tell me Italian. Why? I can eat the Italian in Italy. Yes?
Yes, I totally agree. I confess that when I go for a holiday in another country, I love starting eating local cuisine, and I ate eating Italian abroad.
Yeah. This
I
is
don't like.
yeah. Maybe you will like the Italian food after, for example, spending 7 days eating the local, and you need to go back to your home country food for a while and go back again to the local. Sometimes it happens if
Yes.
you are going to stay for a long time, but if you are going to stay a few
Few
days,
days.
it's preferable to eat the local. I hope that did you go for the breakfast?
Yes. It is
Breakfast.
very a wonderful breakfast. I saw a lot of local.
What did you see?
thing.
Do you remember?
I was curious about a sort of bread that was circular, but I don't know the name.
You don't know the
asked,
name.
No, I don't remember. I asked about
Just
but
bread, nothing inside this bread.
nothing inside.
Just bread.
Just bread.
Yes.
And
You get excited from bread, Francesco?
sometimes.
Okay.
And
What did you see else?
I saw a lot of sweets.
Sweets. Egyptian sweets.
Egyptian sweets.
You didn't see the full beans.
Beans.
Did you see the
Yeah, I
Egyptian
think-
beans?
Yes.
Did you eat it?
No, because it was.
You were afraid.
Yeah.
You're afraid. You need a guide to tell you how to eat the beans, the Egyptian beans. هو ده اللي بقوله يا جماعه. طبعا محتاج تور جايد معاه ازاي ياكل الفول، وخصوصا لاول مره. احنا حتى عندنا الاطفال في اول وجبه فول بتبقى العيله كلها متجمعه حواليه، عشان في مرض اسمه الفافيزم، اللي هو ساعات بيبقى فيه نقص في الجي سي 6 بي دي انزيم. ده انزيم اسمه كده، ساعات بيبقى مش موجود في الناس. You know about the fafism, the G6PD deficiency enzyme. The first time any child, Egyptian child, is going to eat beans, they are very worried about is he's going to make it or not, because it makes hemolysis and sometimes need blood transfusion. One of my relatives had this problem. كان عندي واحد من قرايبي، دي فعلا يعني اكيد كلنا عارفين القصه دي، ان اول اكله فول لاول طفل بتلاقي العيله كلها بتتلم حواليه، بتفضل بصاله ان اليوم يعدي على خير. انا ليا واحد قريبي فعلا اول مره كل فول حصل له هيموليسيس، تكسير جامد جدا في الدم، واضطر ان هو ينقل دم فعلا. وكان المشكله كمان ان هو كان او نيجاتيف، وطبعا الاو نيجاتيف دي من الفصائل اللي هي بتبقى نادره قوي، بس الحمد لله لحقناه وادينا له كيس دم. فالفول يا جماعه ما تستقلوش بيه، ده موضوع كبير، ده موضوع خطير، بس هو طبعا احلى اكله في الدنيا. السلام كده في فول بالزيت الحار كده، ياه، وعيش بلدي يكون العيش الملدن. عارفين العيش الملدن اللي هو كده يعني مش ناشف ومش طري، هو كده تلاقيه كده كده كده، ها يعني هو كده، يعني مش عارف اوصف، بس هو بيبقى عيش كده وبصل بقى، ومش اي بصل، انا بحب قوي البصلايه بتبقى متقطعه 4 ومحطوطه في طبق غويط وعليها شويه خل وشطه. اوعى اوعى تاكل من هنا وربنا يستر، بس اكله تحفه. You need a guide.
I need the guy.
Yes, you need a guide for this Egyptian food. Did you see something called falafel or طعمية?
Ameya.
Do you know this?
No.
Okay, it's a kind of ground beans with some veggies and herbs, and it's grounded and it's became like a paste, a green paste. This green paste, they took it and they fried it in the oil. Fantastic.
Taste.
Fantastic. But also it needs an ambulance beside you. عربية إسعاف جنب طبق الطعمية ده، عربية إسعاف طبعا. بالنسبة لفرانشيسكو I'm telling that for you we have to rent an ambulance beside us when we start this cool طعمية كشري. Okay, let me tell you about the koshari. Koshari is the Egyptian pasta. You know the components of the koshari?
No.
Okay. Rice, spaghetti, you know the macaroni, the pasta, which is the small one, rounded, I don't know its name. On it, lentils, العدس الاسود، ابو جبه، اسمه ابو جبه. ها الخواجات او الفرافير بيقولوا ايه؟ بيقولوا ايه؟ بيقولوا ابو جبه. الفرافير بيقول لك العدس الاسود. All of this mixed with each other and they put on it tomato sauce, and this is our pasta called koshari. It's delicious. And you know they put fried onions on it, caramelized onions.
And you eat it in particular condition or
In emergency.
festivity?
In emergency. في حالات الطوارئ يعني. حالات الطوارئ emergency we take koshari because it's in a box. You know the boxes, for example, for the Indian or the Chinese food, and with the plastic spoon, and you know sometimes they put it in a bag, and they wrap it and they make a small hole in the bag and put this small hole in their mouth and they push it. Yes, squeeze and take this koshari inside. You'll see a lot in Egypt. You didn't see anything. You just see the Semiramis Intercontinental and the River Nile.
There is a lot.
Yes, there is a lot. This is the part. The other part I want to see the nightlife. We have a very nice nightlife and elite one, and this is my specialty. Okay, so don't worry about that. You are getting your wife with you.
It depends.
Okay. If you get your wife with you, we'll go to a special part for the nightlife. If she didn't come, we'll go to another way. Okay? Agree?
I totally agree.
Okay. You love Egypt. Equalizer. We forgot about the equalizer. Yes?
Yes.
One of the most important thing I want to know, how costly is the equalizer in Italy? For example, if the patient came to you, he doesn't have any kind of insurance and he's going to pay for the equalizer. How much it will cost him? Average. I think there will be variations between a doctor and the other, center and center, but the average price between what and what?
4 and 6,000
Between 4 and 6,000 euros.
euros.
يعني هنتكلم في متوسط 5000 يورو. احنا طبعا بنعمله هنا ببلاش، يعتبر ببلاش، عشان كده الناس بتجيلنا الميدل ايست. It's very expensive because here it's more cheaper than that.
It's very expensive, but this is, you have to consider some costs that you have to afford for the company made by needle fibers. So, in Italy, this is approximately the price.
The price for
to do in private this procedure.
Okay. And how many patients or the percentage of the patients who pay cash for this technique? Little or the majority or half and half?
In Italy, little.
In Italy, little. most of them the insured patients by
Yeah.
and the equalizer inside the insurance
In,
protocol
in the last 2 years, yes.
before it
It's
wasn't.
increasing. Before, no.
Oh, maybe so that's why maybe in the first few years the number of patients absolutely was little the rate of doing equalizer.
In private, yes, we did in the public system, but for private, for the first year, it was not so easy because of the insurance. After the insurance recognized the role of equalizer and identify a codes to obtain a refund, and then the number, of course, increased.
Yes, that's good. يعني يا جماعه الايكوليزر متامن عليه، يعني التامين الصحي. يعني تخيل بقى حضرتك داخل كده عياده التامين الصحي الشامل، تقول لهم والله يا جماعه انا جاي عشان اعمل ايكوليزر. انا مش عارف هيردوا عليك يقول لك ايه، لان هو اصلا مش هيبقى فاهم حضرتك عايز ايه. ايه ايكو ليزر؟ لا، اللي ما عندناش ليزر على فكره. هو الايكو ليزر ملوش علاقه بالليزر، لان الليزر حاجه والايكو ليزر حاجه. وكلمه الايكو ليزر جايه من صدى الليزر. يعني ايه صدى الليزر؟ لان الليزر بيبقى سبيسيفيك بيقطع بيه او بيبخر بيه جزء. الايكو ليزر هو الليزر التاثير بتاعه والصدى اللي حواليه. You know why they name it echo laser? Because I think they get this name from the effect that happens around the fiber. Do you think that, or I'm thinking wrong?
Uh, I have two theories about that.
Okay, tell me about the two theories.
The first one, the most simple, is that echo laser done performed with ultrasound echographic
Okay,
under guidance.
okay,
The other theory is, as you said before, about the echographic effect that is obtained with the ablation.
okay, okay.
That is a sort of bubble alteration of the echogenic effect of the prostate, and you see in this hyperechoical area all around the adenoma.
هو الكلام اللي احنا قلناه، الايكو ليزر، صدى الليزر، او طريقه الليزر اللي هي التفاعل بتاع الليزر حوالين الفايبر. فالصدى اللي بيعمله مش بس في المنطقه المتوجه عليه من الفايبر بتاع الليزر، انما كمان من حواليه. بس هو بقى اضاف لي حاجه جديده قوي، ان الايكو ليزر دي الثيوري الثانيه. يعني هو بيقول ان في نظريتين. النظريه الثانيه اللي هي جديده بالنسبه لنا، ان الايكو جايه من كلمه ايكوجرافي، يعني نوع من التصوير، عشان احنا بنستخدم الاشعه التلفزيونيه عشان نقدر نحدد المكان المظبوط اللي نحط فيه الليزر. فاحنا بنستخدم الايكو ناحيه التصوير، والليزر اللي احنا قلنا عليه اللي هو الدايود ليزر. Okay, what do you think patients would like to hear about the echo laser again?
I mean, in my opinion, if I was a patient,
Yes.
when and I had to have do a visit with the doctor,
Okay.
the question and the answer expected, of course, would be, is it safe? Second, what kind of improvement can I expect from that? And the other one is, are functions about ejaculatory incontinence preserved? Because especially if I am a young patient affording this kind of procedure. So to answer to your question, the answer would be, is a safe and effective procedure, of course, and an organ sparing procedure that allows to preserve ejaculation, continence, and erectile function.
Okay, can I ask you a favor, please? You know, now I start to have little symptoms of prostatism. انا ابتديت يبقى عندي شويه اعراض كده، يعني شكلي كده هخش على تضخم البروستات. بس انا ما دخلت، ده انا سليم ووحش واسد. بس يعني بما ان انا دكتور فبلاحظ ساعات كده في شويه تغييرات. If I need to do an echo laser, will you please do it for me?
It is
I will invite you in Cairo, and we have a nightlife, and we have everything. Okay, and maybe someday you will do an equalizer for me. Do you agree?
yeah. Of course, I should visit, but it is of course an opportunity.
Okay.
It depends on symptoms. It depends on prostate size. It depends on prostate characteristics. But of course, it's an option.
I'll tell you some secret. My prostate is 60 grams. Do you like?
The ideal candidate.
Okay. خلاص. We have a deal. If I need to do an echo, if I have a prostatism and indicated to do intervention, you will do it for me. But we will do it here in Egypt. Okay? In the same hospital we perform today the two operations. احنا النهارده عملنا عمليتين، واحد من ليبيا وواحد من مصر. اللي من مصر I'm talking about the Egyptian patient that he was a young patient، كان سنه صغير 48 سنة وعنده احتباس بولي وكان مركب قسطرة وبقاله سنين بيشتكي. فطبعا 48 سنة ان هو يفقد القذف وممكن تأثر على الحالة الجنسية وان هو يعمل استئصال البروستاتا، الحقيقة نفسيا مدمرة. يعني قبل المشاكل اللي هو ممكن يتعرض له مطرح اجراء استئصال البروستاتا في عيان 48 سنة مدمرة. فالحقيقه الايكوليزر من الحاجات اللي هي يعني رائعه بالنسبه للسن الصغير ده. وكان العيان ده بالذات عنده مشكله اللي هو بنسميها الفص الاوسط، الميدل لوب. زي ما احنا عارفين ان البروستاتا فيها فصين وساعات بيبقوا 3، فص ايمن وفص ايسر وفص اوسط، بس ده ما بيكبرش قوي. ساعات لما بيكبر قوي بتبقى مشكله كبيره وبيعمل مشاكل كتيره زي العيان اللي احنا قابلناه النهارده، وكان عنده مشكلة في التبول لدرجة إن جاله احتباس وبقاله 17 يوم مركب قسطرة. You know how many days he had a catheter? He told you?
Yeah.
This is the patient that we performed today. One patient that
Yes.
there was retention that he is 48 years old. 17 days. He had retention for 17 days. And he tried to remove the cath, and he failed twice within the 17 days to micturate. So he decided to do
yes procedure.
And the most important thing I didn't tell you, this patient, one of the urologists, one of the eminent urologists, he referred it to me, and this is to me is a volcano. That a urologist, an eminent urologist, is convinced by this technique, and he referred to another urologist to do this technique. So we are on the right track.
I'm really convinced about that.
We are on the right track. We have to expose more to the urologist to know about this technique and to see the result, and to let more urologists convinced by this technique and to do this technique by themselves. And we are ready, and I know that you are ready also to help these urologists to learn them. احنا ما عندناش ايمان على فكره ان احنا نعلم الدكاتره اللي عايزين يتعلموا التكنيك ده. بس هو اهم حاجه في التكنيك ده, the most important thing for this technique, you know, one of the issues that making this technique not propagating quickly between the doctors, the transrectal ultrasound background. Not all urologists, maybe minimal number of urologists know how to do transrectal ultrasound. Maybe they are not more than 5 to 10% of our urologists in Egypt can do this, especially in the old school. They don't do any ultrasound. Maybe the juniors, they have better experience with the ultrasound than the you have the same issue in Italy?
In Italy, it's quite similar, the situation. This is the reason why, in my opinion, it would be interesting to create workshop like the ones we will do tomorrow.
Tomorrow we have a very important workshop, and I think we will have a big traffic for this workshop.
Sure.
Yes.
And it would be very interesting to create this kind of workshop on a theoretical but also on a practical point of view, because this is the only in my opinion, the only way to make the technique known from the other colleagues and to improve this technology and to make our colleague able to perform.
You know, this is the only, or this is the first workshop to be done in the Middle East, not in Egypt, in the Middle East, for training doctors about equalizer. Do you have any idea about this? It's the first workshop in the Middle East. احنا اول ورشة عمل عن الايكوليزر، وهنعمل تدريب لدكاترة المسالك عن كيفية اجراء الايكوليزر بكرة في مؤتمر يوروبرو الرابع اللي معمول في الانتركونتيننتال سيمراميس، اللي هيعمل الورك شوب انا ودكتور سيسا. سيسا, yeah, I'm pronouncing right, not Sisa, because they all the time will call Sisa. It's not Sisa, it's Sesa. Francesco Sesa. I want to do some training about Francesco Sesa, because Francesco it reminds me by mafia's name. There is Francesco mafia's name. Francesco Totti.
Sounds better.
Sounds better. فبكره يا جماعه احنا عندنا تدريب مهم جدا لدكاتره المسالك. You know, that's why that انا هكمل معاكم بس ده سؤال مهم جدا انا بس افتكرته. That's why the radiologists they are getting on this technique quickly than the urologists,
because they are competent with ultrasound.
The who are making the equalizer in Italy, most of them urologists or most of them radiologists, or 50-50?
More urologists.
More urologists.
Yeah.
This is very good. I'm very proud of that. You know why? Because, for example, for the embolization,
completely opposite to the situation.
Radiologist 100%. And the main problem that they treat the patient. They are not performing the technique. Here in Egypt, they go to the radiologist and he decides that you need this technique. Even he doesn't know if he can do a medical treatment or even that this technique after that how he's going to follow up. عندنا مشكلة كبيرة جدا الحقيقة، خصوصا في الإجراء اللي احنا معروف عنده اللي هو الامبولايزيشن او عن طريق التدخل الإشعاعي او التدخل عن طريق القسطرة الإشعاعية لقفل الشرايين البروستاتا. ودي كلها مش اغلبيتها، كلها اللي بيعملوها دكاتره اشعه. فهم بيعملوا هذا التكنيك للعيان، بس الحقيقه هم ما عندهمش اي فكره ان هل العيان ده فعلا محتاج التكنيك ده، لان هو مش دكتور مسالك، هو دكتور اشعه. وفي نفس الوقت بعد ما بيعمل التكنيك ده عنده كذا مشكله. المشكله الاولانيه ما بيعرفش يعمله فولو اب، ما بيعرفش يتابعه بعد ما يعمل التكنيك ده انه بقى كويس ولا وحش. هيعرفها منين؟ ما عندوش التولز او ما عندوش العلم اللي في دماغه ان ازاي يقدر يقيم ان العيان ده اتحسن ولا ما اتحسنش، ولا محتاج اي حاجه تانية، او محتاج متابعه بطريقه معينه، او لو حصل له اي مضاعفات هيتعامل معاها ازاي. ما بيحصلش الكلام ده، وده انا شايفه موضوع خطير جدا. انا مش ضد الاشعه التداخليه، انا ضد ان دكتور الاشعه هو اللي يعالج المريض. يعني ممكن الدكتور المسالك هو اللي يحول المريض لدكتور الاشعه التداخليه، يعمل له الاجراء، وبعد كده المريض يرجع للدكتور المسالك عشان يعالجه، يتابعه، يشوف اذا كان في عنده اي مضاعفات ويقدر يقيمها. At the end of our podcast, what do you want to tell us and to tell the Egyptian audience, السادة المشاهدين والمستمعين، عشان بيزعلوا مني لان انا دايما بقول المشاهدين والمستمعين كمان. What do you want to tell anything about the Egyptians, and what do you think about them? You told me some tips in the elevator. I want the audience to hear that from you.
Yes, it would be interesting that people, doctors and know about this technology, are curious about this technology and wants to improve this technology. And one of my goal would be to share data.
No. I don't. I want to hear another thing. you told me something about the Egyptian women. This is the most important. ده الأهم. نتكلم على الستات. خلاص كفاية إيكوليزر. Enough about إيكوليزر سيسا. Okay?
Stop.
You told me something about the Egyptian woman. I want to hear it again, please. And I want the audience hear it about the Egyptian woman.
I confess that
Confess.
Confess.
Okay, take care about what's the name of your wife? Anna. Hear that, Anna. He's going to confess. Take care. And this is a podcast. This is not secret. This is on public. Go ahead.
That there are a lot of very kind and very good Egyptian women.
Only that?
Only
You're a liar.
Only that.
You're a liar. Anna, he's lying. He didn't tell me that, Anna. When you come Egypt, I will tell you what did he told me about the Egyptian.
No more alone.
Okay. Thank you very much, Sisa. Really, I'm pleased by knowing you. And I think we will have a very good friendship and collaboration in work. And we'll do a lot of work for the patients and for the Egyptian urologist, both of them, patients and urologist. احنا متفقين ان احنا هنعمل مجهود مع المرضى المصريين ان احنا هنفيدهم بالخبرات الإيطالية مع الخبرات المصرية عشان نجيب احسن نتائج. وكمان هنفيد دكاترة المسالك المصريين بالتكنيك ده ان احنا نعلمهم بأحسن طريقة بأكتر خبرات إيطالية ومصرية. خبرات البيتزا، لأن الإيكوليزر هو زي البيتزا. بيتزا طلعت من إيطاليا، الإيكوليزر طلع من إيطاليا. Thank you very much. Nice to meet you. You meet again. Okay. Bye. بودكاست مش للرجال فقط.